Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the pivot shift assessment. What is a pivot shift test or assessment? The anterior cruciate ligament, or the ACL, is a crucial part of the human body composed of tough, fibrous tissue. Located in the knee joint, it provides stability when running, jumping, and changing directions. Without the ACL, these activities become difficult, which leads to further pain or injury. ACL injuries are relatively common among athletes who engage in contact sports such as football or basketball, and those who participate in activities like skiing or skateboarding. To help diagnose ACL injuries, a doctor may perform the pivot shift test. During the test, the doctor will move the leg to evaluate how much pressure is necessary to cause a shift in the knee joint. There are a variety of healthcare professionals who can use this test, but it is mainly used by physical therapists. Here's how to use the pivot shift test. The first step is to fill in essential information and read the instructions as well as the reminders. The second step is to then conduct the assessment. Finally, you'll then need to record relevant notes to be used within treatment. To view a sample assessment of the pivot shift test, feel free to visit carepatron.com where you can download and access the test for free. You can also access the test within our platform itself. Simply filter by community and by assessment, and you can type in the keywords to find the note faster. Thanks for watching, and remember to subscribe to Carepatron to learn more about healthcare.